All right, welcome to the Kinesthetic Knowledge on Record, your go-to resource for in-depth discussions on fascia, anatomy, and your body. I'm Aya, and I'm thrilled to be joined by my co-hosts Mahnoor and Isha. And today we're going to go into the intricate world of pregnancy-related pelvic girdle pain and its impact on the body.
Yay, thank you, Aya. So we're really excited to have all of you listening in today. And just like Aya mentioned, our focus today will be around pregnancy as a case study, and then we'll look at the different ways that fascia and the muscles are involved in this journey. And so, pregnancy-related pelvic girdle pain, or PGP for short, affects a significant number of women, and this can happen during and after pregnancy. And usually, the prevalence is approximately having 45% of individuals with PGP happening during pregnancy, and then there's 20 to 25% that happens during the early postpartum period. And because of this, we thought that it is a topic that deserves a lot of attention because it can have a lot of long-lasting effects on women's health as well as their overall well-being. But because I just mentioned PGP, I do want to orient our listeners to what exactly pregnancy-related pelvic girdle pain is. And so first, the pelvic girdle is basically a ring of bones that's around your body and attaches at the base of your spine. And so PGP is pain that is felt in the front and or back of your pelvis, and it can also affect areas such as the hips or thighs, but it can also affect the sacroiliac joints at the back and also the symphysis pubis joint at the front. So it's pretty much the whole ring, and it's a bit more, it's affecting other structures as well. So we'll do a deep dive into that.
Yes, absolutely, Mahnoor. Thank you for giving that orientation. I think that's really helpful to let the individuals listening in know what exactly we're talking about and where. So I think what's really interesting about this topic is how kind of like the muscles and the fascia of the lumbopelvic region really play that crucial role in the musculoskeletal function, as well as continence and respiration during this whole process of pregnancy. So during pregnancy, you could imagine that you are carrying like varying low levels of load on your body. And in order to do this effectively, your trunk muscles need to act synergistically in order to optimally balance that control of movement while also maintaining that optimal joint access and axes and maintaining like sufficient pressure in the abdomen without really compromising the organs. Otherwise, that's when you have these issues such as lumbopelvic pain, you have incontinence and breathing issues. It's when all of this goes wrong that you start to have these symptoms, even prior to, during, and even after labor. So I'm sure you guys both came across a lot of research that's kind of exploring this combined prevalence of lumbopelvic pain, incontinence, and breathing disorders. And I'm sure that you guys have kind of realized that it is slowly being understood in the medical community, and there's been a lot more research that's been happening as of right now.
Cool. So that's where fascia comes into play. And basically, just to start defining what fascia is, it's basically connective tissue that envelops or surrounds our muscles, our organs, and other tissues in the body. So it's kind of like a support system that holds things together. And we're going to focus more on like our lumbopelvic region for the purposes of this podcast. So when the fascia is compromised, whether it is due to pregnancy-related changes or trauma during delivery, this can lead to the pain, the incontinence that we've talked about, and also some of the breathing disorders that we're going to look into in our podcast. The intricate balance between muscles and fascia, which is basically put together the myofascial system, is essential for the optimal load transfers through the body.
Yeah, I completely agree with that, Aya. I think it's important to realize that it's not just one system that's like solely leading to all of these issues. It is a combined impairment system that leads to all of the symptoms we just talked about. So we have fascia that's like obviously highly integrated into the muscles and other organs, like you kind of said, but there are also multiple other systems that are at play, which include the articular, the neural, and visceral system. And these are what lead to those non-optimal strategies and exacerbate these symptoms.
Yeah, I agree 100% with you, Isha. These systems are all interconnected, and that's why when one structure is impacted, we need to look at all the other structures. So we need to consider the interconnectedness when it comes to the body function itself. And so a question that we can ask is, what do you think are common issues women may experience due to pelvic girdle pain and after pregnancy as well?
Yeah, so that's a great question because again, everything is interconnected and one thing leads to the other, like we mentioned. And so, one of the most prevalent issues that can happen after pregnancy, after one has given birth, is urinary incontinence. And then, so to define that, urinary incontinence is essentially the loss of bladder control. So this is when, you're not able to control your bladder like yourself. So the severity of this can range like differently. So this can usually have like this can be usually where there's occasionally leaking of urine when you call for sneeze, or you have this very sudden urge to urinate, and you're not really able to get to the washroom in time. And then, so a lot of studies and the research that we did have shown that there's a significant percentage of women that experience urinary incontinence years after giving birth. And then, so some specific stats are that there's 45% of women who experience UI at 7 years postpartum, but there are also 27% who were initially incontinent and then they became they regained continence, so it was reversible. But there were also around 31% of women who were continent after they gave birth, but then they became incontinent. So there is varying timelines, there's different stats, and all of this makes it just very apparent that for some women something happens during pregnancy and delivery, and then for some women it may happen after. But regardless, it will always impact the function of their abdominal canister, like I mentioned, either immediately or over time.
And let's not forget about the impact on the pelvic floor function. I think you guys know quite well is that there are a number of muscles, both superficial and deep, that make up that pelvic floor. So that includes like the perineal muscles and the levator ani muscles. And these pelvic floor layers, as well as the urethral and anal sphincter system, play a significant role in maintaining that pelvic organ support and ensuring continence. And these muscles interact with supportive ligaments and fascia to maintain that support for the organs and to prevent the pelvic floor connective tissue from excessive load, protect, not prevent, from excessive loads. So I came across a very interesting analogy called the boat in dry dock theory, which is in which essentially the pelvic floor muscles act as the water in the dock floating the boat. The boat is actually our pelvic organ. So the boat is unloading the anchoring, which is actually the ligaments and the fascia, which kind of hold the boat in place. So if you guys imagine that that water is removed, say we lose pelvic floor muscle tone, that anchoring or the ligament and fascia are placed under extensive strain. What happens during pregnancy, labor, and delivery is that we have intense stretching or tearing of the tissue of the pelvic floor complex. This obviously occurs either slowly over time as the fetus weight increases or traumatically with things such as vaginal delivery. So the excessive stretching of these fibers, as well as the likelihood of muscle denervation, can actually lead to impaired muscle strength and endurance. And this leads to issues like diastasis rectus abdominis, or DRA for short, and pelvic organ prolapse. I think it's important to mention that there has been numerous studies to show defects in the levator ani muscles in particular, and its attachment and the surrounding fascia after an individual experiences prolapse. And one of the key questions in the literature today is definitely whether C-sections offer that protective measure against symptoms such as pain and incontinence, because vaginal delivery is the one that really leads to that excessive tearing and excessive load. So there are definitely mixed conclusions, and I'm excited to see what the conclusion in the end is. However, I think what's important to understand is the role of fascia and muscles in supporting that pelvic region, particularly the floor, as well as how postpartum these issues continue to persist because of the strain that was put on during this time.
Very cool.
Thank you so much for sharing this, Isha. I liked how you mentioned all of this information on pelvic floor connective tissues and excessive loads. But also there's additional information or factors that contribute to the changes in the myofascial structures of the pelvic floor muscles. So one significant one is actually the strategies that are used by pregnant women for postural and trunk control during everyday function and performance. But I want to connect that to gait as well, and as pertains to postpartum adaptation, which is quite connected to fascia. So before going into postpartum situations, I want to kind of connect to fascia and connective tissues in like individuals who are not pregnant or are not post-pregnant. So fascia as a connective tissue, as we said, is characterized by elasticity, basically properties of stretch, recoil, and swinging. So when moving, one can take advantage of this elastic characteristics when walking, with a very important structure being the lumbodorsal fascia in our lower backs. This fascia structure connects our forelimbs together, so our upper limbs and our lower limbs, because it connects the latissimus dorsi, which are muscles at the back. And although there are muscles at the back, they don't really control your back muscle, your back movement, as much as they control your upper limb movements. And then it connects to the gluteus maximus, which kind of controls or helps you with walking. So it's kind of a middle point in our body, and it's very important to use when we walk. It needs to be moving when we walk. And so what they found is that women in Africa can hold so much weight on their heads when walking with minimal energy, because they take advantage of this elasticity and the structure of the lumbodorsal fascia, which basically what they found is that their pelvic moves when they're walking more than the pelvic of people in Europe or Western countries. And so that is important to have this kind of movement as we walk and get this elasticity and kind of have advantage of the fascia. So when walking, the rotation of the pelvis is important, but there is also the pendulum-like movement that is important as well. So what is recommended is that your knees shouldn't be really bent. They should be a little bit more straight, and you should take long strides. And so the potential energy that is stored in the leg that is not moving propels you forward like a swing. And this is all possible because you have so much interconnection in your fascia. So we can also take advantage of our upper limbs, which are connected to our lower limbs, when we move them back and forth, like when you move your arms back and forth as you walk to help with this elastic movement. And so again, everything is connected, and we should take advantage of that. So what happens with postpartum pregnancy is that women kind of take advantage of non-optimal strategies that develop because of habit, pain, or injury. So what they found in like their studies with women who gave birth before and women who have never given birth, or before and after childbirth, they found strategies like butt gripping or chest gripping, which alter the pelvic and trunk control. These strategies alter the hip joint position, increasing pressure in the lower abdomen and causing asymmetric tension lines within the myofascial system. And that is a problem because this asymmetry in the tension lines of the myofascial system alters the stiffness and the symmetry throughout the tissue that supports our stability. And so these loads on our myofascial system causes changes in the myofascial integrity, and kind of changes over time. So it's very important to take this into account as we have patients that kind of do all of these non-optimal strategies and suffer because of all of that asymmetry.
Thanks, Aya, for your summary. I think what I was really surprised about is how such common practices, we don't really expect them to lead to something big, such as postpartum issues. Like, for example, butt gripping is very common. I have seen many individuals who are pregnant using that strategy, but in order to see how that kind of like alters the stiffness and the symmetry through these like support tissues, that was very interesting. I think if I were to summarize for our listeners here on what we just kind of talked about, it's that we are noticing multiple myofascial defects of the pelvic floor, which occur during pregnancy and delivery. And what's interesting is how it kind of carries over to the postpartum period. So as kind of Aya, you really highlighted with those strategies, optimal and non-optimal. There was also mention of compensatory strategies for trunk control. So actions, like I just said, butt gripping and chest gripping, and how they can kind of contribute to the development of further impairments. And even if, for example, the myofascia survives through the trauma of that's given of that's given from pregnancy and delivery, over time, the use of these non-optimal strategies for load transfer can still occur. So I think what's really important to understand is that these symptoms that patients present with, whether it's lower back pain, pelvic girdle pain, incontinence, organ prolapse, etc., will all depend on the piece of system that is most impacted by or is most predisposed to function. And this obviously could be exacerbated due to past experiences. That was kind of mentioned if you've given birth before or not, or injuries or genetic or hormonal influences.
Thank you so much, Isha, for your summary. So now let's switch path. Maybe let's elaborate a little bit on how changes in breathing patterns during pregnancy can affect pelvic health.
Yeah, so that's a great transition. So, we kind of talked about pregnancy-related hormonal changes a little bit, like briefly, but what this can actually do also is lead to alterations in your breathing patterns. So this can introduce like shallow or dysfunctional breathing. And when you have shallow and dysfunctional breathing, you actually are increasing the tension in your pelvic floor muscles. And when you do that, you're also exacerbating your pelvic pain. And so it's really important is to understand this connection between breathing and pelvic health, because this is what's important for supporting women during this time of pregnancy, birth, and labor. There's also a lot of, like I can mention, there's a lot of physiological changes that can occur during pregnancy as well. And this can actually impact the integrity of your fascial support system. And so I know, Aya, you looked into this a little bit. So I'm just wondering if you could share more a little bit about what happens to your fascia with breathing and pelvic health.
Yeah, thank you so much, Mahnoor. I think it is important to kind of bring in the nature of fascia and connect it to pregnancy and breathing, because there's an important thing called elastic breathing with fascia. And so let us remember that fascia is, again, an elastic tissue. It is characterized by stretch and recoil. And that's not just applicable to when you're walking or swimming or running, like mechanical movements like that, but it's also when we breathe. So we have something called like the resting tension state, or the stage of resting tension when we breathe. And it's basically the between point, like in between of inhalation and exhalation. So inhalation is the stretch to expand. And when you exhale, that restores the resting tension. When we go beyond exhaling, so when we squeeze more air out and then contain our breath, it works the opposite way. So the tension is restored by inhaling again. So it is a whole story of physics and biomechanics, but it's quite relevant to pregnancy because those short breaths do not take advantage of this elastic property of fascia when breathing, because you're not really stretching or recoiling, you're just taking really very shallow breath. And I would like to think of it as like a constant state of stretch with no restoring of tension. And so pregnancy is associated with reduction in CO2 levels, also known as hypocapnia. Is that how you say it?
Yeah.
Yeah, so which can affect the structure and function of fascia. And if you guys want to learn more about that, you can also check Mahnoor's video on CO2 levels and hypocapnia.
Yeah, it's incredible to see how interconnected these systems really are. And I was wondering, Aya, are you aware of how like healthcare providers can address these issues and support individuals who are pregnant during and after?
That's an amazing question, Isha. Healthcare providers play a crucial role in addressing pelvic girdle pain and its associated issues. So this may involve a multidisciplinary approach, including physiotherapy, chiropractic care, massage therapy, and so on, to address facial imbalances and improve muscle function. So empowering women with knowledge and resources to support their pelvic health is essential for promoting these optimal outcomes.
And I completely agree with your comment on empowering individuals with knowledge and resources, because I think that a lot of people are unaware about these issues and how these issues carry over. I was also very interested on your comment about like physiotherapies and exercises, for example. I know there are therapies out in the market that focus on training, for example, the pelvic floor muscles to reduce the risk of incontinence in particular during and after childbirth. One example is actually Kegel exercises. I'm not sure if you've ever heard of them before.
Yeah,
Yeah.
a little
Mhm.
bit, but maybe you can explain more.
Yeah. Kegel exercises basically focus on teaching one to consciously pre-contract the pelvic floor muscles before and during situations that kind of cause increased abdominal pressure. So, for example, coughing. So, these exercises have actually been found to increase muscle strength and hypertrophy, building up that long-lasting muscle volume to provide good structural support. So I think I'm strength training, and I did a lot of research in other cases as well, but I would imagine it would hold the same potential because of the benefits such as improved neuromuscular function, increased cross-sectional areas, increase in the number of activated motor neurons and frequency of excitation, and overall just like an improved muscle tone. So it's definitely a great avenue to explore when addressing these issues.
Very interesting, actually. Thanks for sharing. I never heard about it before, so it's great.
Yeah, I'm learning a lot.
So I think that was all that we had for today. Before we wrap up, I think it would be a great idea to kind of reflect on the key takeaways from today's discussion. Mahnoor, what would you say was the most important message for our listeners?
Yeah, thank you. So I think the one or like one key message that we could take away, listeners could take away, is that pregnancy-related pelvic girdle pain is a common issue and it deserves attention and support. And it's not really something to be embarrassed by because often when you read research or you communicate with individuals, they mention that although it's a natural occurrence, it can be a little bit embarrassing, but it deserves attention and support. Don't need to be embarrassed by it. And another thing we can do is that by understanding the role of fascia as well as the muscles that are related to pelvic health, I think that we can actually better address the underlying causes of pain and dysfunction. And then when we give these explanations and we give these understandings, it actually empowers women to take control of their health when they're actually going into medical offices, etc.
No, that was very well worded. I completely agree. I think it's really crucial for healthcare providers to also take a holistic approach to pelvic health, addressing not just the symptoms, but also the underlying facial and musculoskeletal imbalances. It may be often that patients are going into the clinic and their conditions are not actually being understood. And so by working together, we can provide a comprehensive care that supports individuals throughout their pregnancy journey and beyond.
Yeah, and let's not forget the importance of education and awareness and continuing this education journey, because by sharing this knowledge and all of these resources, we can empower women to advocate for their pelvic health and seek support when they need to be able to thrive during and after pregnancy.
Okay, so thank you to our listeners for tuning in today to today's episode of Kinesthetic Knowledge on Record. And a special thank you to our guests as well, everybody here. So everybody tune in next time and take care.
Take care, everyone.
Bye.